Let's wrap up our discussion on prefixes with prefixes for status, conditions, symptoms, and also diagnostic procedures. So let's look at the prefixes a, an, and Anna. Similar prefixes, but they're used in medical terminology to give us important clues about the meaning of the word. Now, a and an mean no, not, or without, or lack of. So they're often used to describe a deficiency, the absence of something, or an abnormal condition even. So the example here is amenorrhea, but I'm going to give you some other examples first that we've seen. So anemia, we see an, the prefix without, emia is blood. So anemia refers to essentially without blood, but really it's a lack of red blood cells. Aseptic, again, just on its own, a meaning without. Septic refers to infection, so aseptic means free from infection. Aphasia we've seen before, so a is without. Phasia means speech, so aphasia is the loss of the ability to speak. Now, in terms of usage, an is often used before vowels. So if the root, such as with emia, referring to blood, starts with a vowel, an E, that's why we use an. And in aseptic, septic starts with a consonant, so we use just a on its own. So an is often used before vowels, and a is used before consonants. The example on this slide here is amenorrhea. So amenorrhea, again, a is without or lacking. The root would be, and I'll highlight it here, so prefix a, the root would be men, o, and we have suffix ria. This refers to no menstruation or no menstrual flow. So literally it means without menstrual flow. Now, medically, amenorrhea is a condition where a person who normally menstruates stops having periods for typically 3 months or more. This term is used in gynecology to describe various causes, because there are many different reasons for the occurrence of amenorrhea, and this could include hormonal imbalances, extreme stress, rapid weight loss, or even some underlying medical conditions. So, for example, and an example in context, if a patient with amenorrhea is observed, they may undergo testing to check for other underlying causes, such as thyroid problems, which are leading to hormonal imbalances, or other hormonal imbalances, such as reproductive hormone issues. So the key point here is that the prefix a signals absence. No, not, without. So immediately telling a healthcare provider, for example, that something expected is missing. And in this case, the amenorrhea is referring to menstrual flow. Now, Anna refers to up, or again, or apart. So in analysis, lysis means to separate, Anna meaning apart. So essentially to separate apart. So analysis is a procedure, or analyzing something is to separate apart, or to kind of investigate, break down. So literally to break apart in order to study. In medical and scientific contexts, analysis can involve examining samples, data, or substances to understand their components or their function. Examples may include urinalysis. So urinalysis involves examining the urine to detect things like kidney problems, metabolic disorders, looking at urine contents to see if glucose is present in the urine, which we've talked about previously, particular proteins, blood cells. So if blood is present in the urine, this could point to anything from cancers or infections. So analysis implies a process of breaking down, examining, investigation. So to break apart, to study, essentially. Now, I forgot to mention here, so in terms of amenorrhea, another cause or sign of an underlying health problem could be polycystic ovarian syndrome, or PCOS. So we saw poly already, so polycystic referring to many cysts of the ovaries. So if there are many cysts on an ovary, this can be associated with amenorrhea, so no menstruation or menstrual flow. Okay, let's look at the prefix dis, which means painful, difficult, or abnormal. It can also mean bad. Now, it usually indicates that something is not functioning properly. So it's often combined with roots that describe a body part or a function of the body to signal that there is a problem or a disorder. And as we can see, there are many examples of this. So here we see dysphagia, which is that difficulty swallowing, dyspnea, which is difficulty breathing, various causes, lung conditions, broken ribs, anxiety, causing difficulty breathing. Some other examples include dysuria, which is, again, urea referring to urine, so painful or difficulty urinating. Dyspepsia would be digestion that is difficult or painful, pepsia referring to digestion. So there are many contexts in which we would use the prefix dis, but consistently it's referring to painful, difficult, or an abnormal state. So it tells us if there's a problem or an abnormality with the function or condition of something. Now, these particular prefixes tell us about condition, change, or even the age of a tissue, and you'll recognize many of these terms from our cancer unit. So we'll start with mal. So mal means bad, poor, even defective. It often describes disease, abnormal function. So it could be used in malignant, which we've seen in our cancer unit, which indicates bad or harmful, referring to cancerous tumors. We also see it in malnutrition, which means poor or inadequate nutrition. Malformation, for example, would be an abnormal formation or development of a body part. So in medical context, mal signals something is harmful, bad or defective that may require attention or treatment. Now, in the case of malignant, again, we know that malignant refers to a cancerous tumor or growth, if a tumor is malignant. Meta means change, beyond, even after. So it's often used to describe a change in condition, stage, or structure. So in terms of stage, metastasis refers to the spread of cancer from one part of the body to another. So a change in the condition or a change in stage involving the spread of the disease. Other contexts for meta would be metamorphosis, for example, so a change in structure, often used in biology, the change in form in terms of caterpillar development. Metabolic, we often see, right? So relating to, or ick, pertaining to metabolism, so the chemical changes that are occurring in the body. So meta often will signal a transition or progression, change in condition, and especially in disease. Neo means new, recent, or young. Often is used to discuss new tissues, newly formed conditions, or even newborns, for example. So a neonate is a newborn baby. Neonate. A neoplasm is a new or abnormal growth. Could be referring to a tumor, for example. So neo helps identify something that is new, recent, often important in growth, development, or also in early disease detection. So a neoplasm was a term introduced having the prefix, again, neo meaning new, plasm meaning formation. So when cells reproduce more than they should, we form a growth, a new formation. And as we saw with our cancerous unit, growths can be benign or they can be malignant. And again, benign meaning non-cancerous. If the cancer spreads to another place, such as other tissues or organs, then this process is called metastasis, meaning place, stasis, that has changed, meta. And here are some various images of moles, and can you spot the potentially deadly mole? So you'll recall that we talked about the various characteristics of a mole that may be concerning or point to a mole that is potentially deadly. We talked about that, the various kind of trademark signs that a mole is dangerous. We talked about the border. So if there are jagged edges, if the size is changing over time, that was the biggest one. So if the size changed dramatically, color can also be an indication. So a darker mole could be a sign of something that is possibly malignant. So if we look at these moles, we see some with jagged edges, we see some with even non-uniform color. So in this one, for example, we see jagged edges. We can see that the color is a lot darker here, a little bit lighter here. These can be signs that a mole is potentially deadly. Okay, understanding sim versus sin. So both sim and sin come from Greek and mean together, with, or joined. These prefixes will indicate like combination or coordination, and the difference between them is mostly based on the first letter of the root. So sim is often used before labial consonants, so that's the consonants B, M, and P. Example with symbiotic or symbiosis. And sin is often used before other letters. So synergy, synthesis. So sim is typically used before B, M, or P, for example. So we see symbiotic or symbiosis. So sim meaning together, biotic pertaining to life. So this means living together. In biology, symbiosis will refer to two different organisms that live in close association, and they often will benefit from each other. Examples in nature may be bees and flowers. But another example of this, especially relating to humans, would be humans and gut bacteria. So the bacteria that is in our intestines. This is referred to as intestinal microflora, which is very abundant in our intestines. And there's a very non-harmful and mutualistic coexistence. So the bacteria that live within our gut, but also throughout our whole body, refer to the human microbiome. And there are over 100 trillion microorganisms that inhabit our body. This includes bacteria, yeast, fungi. So these particular microorganisms will live in close association and actually benefit from one another. There are many different types of bacteria that live within the gut, and they aid in digestion, and they coexist and work together. So they work in cooperation or in combination. Disruptions actually in these microorganisms is actually linked to disease states. So there have been links to diabetes, liver disease, obesity, disruptions in the microbiome or the community of microorganisms that inhabit our body. And I'll use an example of oral health. And so our mouth contains a large population of microorganisms. Excuse me. And a disruption to these microorganisms can result in things like bad breath, or it can actually and is associated with an increased prevalence or observance of things like cavities and negative outcomes in oral health from disrupting the balance and coexistence of these microorganisms. Now, sin in the context of syndrome refers to a group of combined signs and symptoms. So, in carpal tunnel syndrome, carpo means wrist, so pertaining to the wrist. This term specifically occurs when nerves and tendons in the wrist become compressed. And this often occurs with repetitive strain. Can be caused by activities like typing, excessive typing on a computer, people who work, for example, in grocery stores, and who are repetitively, sliding items across the barcode scanner. This can be associated, that repetitive motion, with the compression of nerves and tendons that are in the wrist. This can lead to pain, numbness, and tingling in the hand. So, syndrome, again, refers to a group of combined signs and symptoms. So, there are a combination of symptoms such as nerve compression, tendon compression, so pain from the tendons, numbness from the nerve compression. So, tingling, all of these various symptoms come together in signs, and that the term for this is a syndrome. Okay, now we'll finish off this section of the PowerPoint with ultra. So ultra refers to beyond, and in medical terms, ultra will often describe advanced technology, extreme conditions, or measurements beyond a standard level. So examples here are ultrasound. So in this case, or in this example, we can actually see the movement here, but this shows an ultrasound recording of the human heart. We can see. So because of the way a heart ultrasound is taken, in this image, I'm going to press play here. This is showing an ultrasound recording of the human heart. We can see all 4 chambers of the heart. Now, based on how an ultrasound is taken, the atria are at the bottom of this image, and these would be the 2 ventricles, even though when we look at a heart in the correct orientation of, say, viewing a person in anatomical position, the ventricles are at the bottom of the heart and the atria are at the top. But based on the way that the ultrasound recording and the device takes the image from this particular view, it shows the 2 atria at the top and the ventricles at the bottom. You can see that as the heart contracts, the atria contract rhythmically and the ventricles contract rhythmically. So blood flows from the atria to the ventricles at the same time. Now, this implies that the valves that exist between the atria and the ventricles, also called the atrioventricular valves, we can see how they also open and close rhythmically and at the same time. So blood will flow from the atria into the ventricles in a rhythmic way. And we can see in this video, which is really interesting, the valves falling open and resealing back as blood moves from the atria to the ventricles. So the word ultrasound, if we break down that word, ultra referring to beyond, and the root here is sound. So it's really meaning sound beyond human hearing. So ultrasound uses high frequency sound waves to create images of organs, tissues, or even a fetus during pregnancy. Really interesting. So another use of ultra, for example, ultrafiltration, so filtering beyond normal levels. For example, in kidneys or medical devices like in hemodialysis, filtration will remove excess water or small particles from blood or fluid. So ultra just signals going beyond a normal or expected level, either in function, measurement, or technology. Ultrasonography, again, we know graphy means the process of recording beyond sound. And this is just simply showing what a typical ultrasound machine looks like. So think of ultra again as beyond the usual. So anything with this prefix is advanced, technical, or possibly extreme. So now let's finish up here with prefixes for time and direction, and then just a couple of prefixes that don't quite fit into any of the categories. So ante, pre, and post. Now, ante refers to before or forward, and the example is antepartum. So ante, before, partum means birth. So it refers to the period before birth or before a woman delivers the baby. Now, if ante is before or forward, post is after. So postpartum is the term that we use to describe the period of time being after birth. Postpartum depression is a experience that some patients experience after delivery. So postpartum, after birth. Antepartum means before birth. Another use of the word ante, anterior, right? Ante meaning forward or before, if you will, and ior meaning more. So in this case, anterior is referring to more towards the front or forward. Now, we've just covered ante and post, but pre and post are common prefixes that are used in opposite ways. So pre being before and post being after. So a precancerous polyp is shown above, and this is showing an image of the colon. And a polyp, as we said previously, is a growth of cells in a particular region. In this case, this polyp is present in the colon. So precancerous would imply before cancerous, or the condition of before cancer, really. So a precancerous colonic polyp is a polyp in the colon that is not yet cancerous. But these polyps are often removed because they may be a form of a polyp that is likely to become cancer if left untreated or if left present. Now, pro versus pros. So we're going to look at these two prefixes and clarify when we use each of them. So I'm going to explain these two by using these particular cases. So prosthesis, as indicated with the prefix pros. So prosthesis, pros meaning before or forward. Prosthesis comes from the suffix thesis, which means put or place, and pros meaning before or forward. So this literally means to place before. Now, a prosthesis is an artificial device that replaces or supports the function of a body part and is put before. So examples are artificial limbs, so prosthetic limbs, artificial heart valves, and cochlear implants. A cochlear implant is a surgically placed device that is inserted in the inner ear and helps people with severe hearing loss to be able to hear. And it's considered a prosthetic or prosthesis device. Now, for a cochlear implant, it bypasses the damaged parts of the ear and sends electrical signals directly to the nerve that is responsible for hearing. And we can see that here. So this allows the brain to interpret those signals as sound, even if the body is unable to do it on its own. So it functions as a replacement for the normal function of the cochlea, this region of within the inner ear. Prothrombin is an inactive precursor in the blood clotting process to prevent blood loss. Now, thrombin is, again, specifically a clotting protein. So prothrombin is inactive protein that's circulating in the blood, and it is a precursor. That's why it's referred to as prothrombin. When bleeding occurs, prothrombin gets converted into thrombin, and thrombin helps form a blood clot. So here pro means before, and prothrombin is that precursor protein to thrombin, which is going to help form the blood clot. So when we use pro versus pros, and it is usually of Greek origin. So words that are of Greek origin, specifically pros, it's a lot less common. It appears mostly in words that come directly from Greek. Most of the time, we will see pro, the prefix pro. The S is part of the root from Greek. So it's not like a separate plural or a different English prefix, if you will. Other examples of the use of pro, if we think about with mitosis or the cell cycle, prophase is the first stage before cell division continues. Prognosis is the prediction that's made beforehand about a disease outcome. Prolapse we've seen before, right? An organ slipping forward and downward out of normal position. So these are examples of when we would use pro. Now, re versus retro. So re means back, behind. The prefix re tells us something is happening another time or returning to a previous state. Some examples include relapse, reinfection, rebuild. So if we break down the word relapse, re means again, lapse means to slip or fall. So relapse literally means to slip back again. A relapse occurs in medicine, for example, when symptoms of a disease return or reappear after improvement. For example, when a patient with cancer or even an infection may improve with treatment, but if the disease returns, then this is referred to as a relapse. It does not necessarily mean that the treatment failed. It means the condition has reappeared and may require different treatment. Now, retro means backward, behind, located behind even. So it has some location context as well, but it also refers to direction. So the term retroperitoneal, if we break down the word, retro meaning behind, the suffix al means pertaining to, and the combining form peritoneo refers to the peritoneum. So retroperitoneal means located behind the peritoneum, or pertaining to behind the peritoneum. Again, that peritoneum is a thin membrane that lines the abdominal cavity and covers the abdominal organs. Now, in this image here, we can see that certain organs are considered retroperitoneal because they are behind the peritoneum, which is this covering of these abdominal organs. So located behind the peritoneum, this would include organs that sit behind this lining rather than inside the main abdominal cavity. So examples of organs that sit retroperitoneal is the kidneys, the adrenal glands, the rectum is located behind, the ureters are also here as well. So this location can affect how disease is spread, for example. It influences surgical approach, so whether particular structures are being accessed from the dorsal side of the body versus the ventral side of the body. So now let's move on to these final prefixes that don't quite fit into a specific category. The prefix anti comes from Greek and means against or opposite. It often describes something that works against a particular process or organism. So for example, an antiviral works against viruses, an antifungal works against fungi. When we combine anti with biotic, we get antibiotic. Biotic meaning pertaining, or so tic meaning pertaining to, and against, anti meaning against, and life being bio. So this literally means pertaining to, against life. Antibiotics are medications that fight or kill bacteria. Crucial in treating bacterial infections. And I'll go over a little key history feature here. So a key figure in the history of antibiotics is an individual named Alexander Fleming. So he discovered penicillin in the 1920s, around 1928, which is the first widely used antibiotic. And he discovered this because he noticed that a mold called Penicillium notatum, so this is a mold that produced a substance which killed the bacteria around it. This discovery, of course, revolutionized medicine and saved millions of lives by providing a powerful tool to fight bacterial infections. And this discovery occurred in 1928, but it took about 12 years before antibiotics were actually used. Now, the substance he found, penicillin, was very hard to purify and produce in large amounts. Early attempts yielded very tiny, unstable quantities that really couldn't reliably treat patients. So it wasn't until the late 1930s and early 1940s that another group of scientists developed methods to purify the penicillin, stabilize it, and mass produce it. So by like the early 1940s, it was being used successfully to treat many bacterial infections. So this just is a really good example of how scientific discovery and time is a contributor to life-saving medicine with collaboration and technical innovation, really. So remembering the prefix anti can help us to understand, if we think an antibiotic, agents that act against bacteria, so pertaining to, against life. And Fleming's work really shows how observing nature can lead to life-saving discoveries. So simply by observing mold and the secretions which killed bacteria. Now, we'll end with the prefix dia and how it's used in many contexts, because dia is used in many words in medical terms. So diagnosis means pertaining to knowledge that is complete, or complete knowledge. Literally means knowledge through, or knowing through. In medicine, a diagnosis, of course, is made by looking at symptoms, reviewing history, performing exams, tests. So, in other words, the healthcare provider gains knowledge through careful, extensive examination and investigation. So, diagnosis doesn't just mean naming a disease. It literally means understanding a condition by working through the evidence. So, knowledge gained through analysis, or complete knowledge, if you will. Once a diagnosis is determined, a proper prognosis can be given. So, in medical context, a prognosis is the doctor's educated prediction of the likely course and outcome of the disease. So, if the diagnosis is if we see it as the what, or the what is wrong right now, we can see the prognosis as the what's next. So, how will this affect your health over time? As we saw before, pro in the case of prosthesis, or prothrombin, but for prognosis as well, pro referring to before or forward. So essentially, the prognosis is kind of the moving forward now that we understand or have a diagnosis. There are several other medical terms that use this prefix dia. This provides some examples, but in hospital specialty units and in hospital settings, there are many different terms using dia. So diaphragm, we've talked about the muscle separating the abdominal and thoracic cavities, that physical separation structure. Fram literally means partition, actually. Dialysis, we talked about hemodialysis previously. So Dialysis itself is separation that is complete. And we saw the different types previously, peritoneal dialysis and hemodialysis. Diameter is to measure completely, the full diameter of a circle, say. Diarrhea actually means, if we directly translate that, flow completely. So diarrhea literally means flowing through, describing, again, rapid movement of stool through the intestines. So there are various uses of the word or the prefix dia, but it usually signals movement through something, separation through a barrier, understanding gained through investigation. So this wraps up our unit on prefixes. I'm going to come back to our learning objectives here. We went over the definition of the term prefix. We went over common prefixes and categorized them based on location, direction and time, size, quantity, also relating to particular symptoms or conditions or medical procedures. And we also identified some prefixes that didn't quite fit into a specific category, but we discussed the various ways that prefixes alter the meaning of a word. Now, if you have any questions about this unit, feel free to email me and let me know. Otherwise, have a great rest of your week.